Okay, so for a patient with an SI instability, they'll normally present with buttocks pain, increased weight bearing on the SI, and a slouch spine. You will observe hypertonic glute and hamstring muscles. Okay, so like I said before, a patient with an SI instability will have their sacral base more prominent than their PSIS, and at the same side, their PSIS will be more anteriorly rotated. The long dorsal ligament will be tender to palpation, and the patient will more likely have hypertonic glutes and hypertonic hamstrings. Okay, so with a patient with SI instability, you will also notice that they will have pain with a range of motion breakout. And so what I'm going to do next is I'm going to test the patient's TA muscles to test for weakness. So Janice, what I'm going to do now is palpate around your waist for muscle recruitment. Is that all right?
Yes.
Okay, I'll have you bend your knees first. And I'm just going to lift your shirt up a little bit.
Okay.
And I'm making sure I'm palpating medial to the ASIS right here. So what I want you to do is imagine bringing these 2 points together.
Okay.
Okay. So what I'm going to palpate for is I'm looking for any tension with the TA muscles, but if I'm not finding that, I'm suspecting that the TA muscles are weak, which could lead to an SI instability. So next I want to assess the multifidi muscles. So could you turn onto your stomach?
Sure.
All right, and here the multifidi muscles are back extensors. So what I'm gonna have you do, Journeys, is think about bring your tailbone to the ceiling and palpate for any muscle tension right there. And if the firing is delayed or weak, then we can assume that the multifidi are weaker and it could lead to instability. Additionally, we can test contralateral limb lifts. So Janice, could you lift your right arm up as you're palpating for the left multifidi? Feel that kick on. Can you lift your left arm too? And the same rules would apply. So for column 2, we're going to be applying our BMCs and external stab. What I'll do first is the BMC to the SI joint. So what I'll do is apply an anterior force to the sacrum and have counter pressure at the ilium. So I'll do that and have you go into flexion. Okay, did that feel good?
Mm-hmm.
All right. So now what I'm going to do, I'm going to apply external stabilization. This is going to have the iliums go into their closed pack position of nutation. I'll first compress medially and do a rotation and do a hug and lift. So can you go into flexion? All right, and how did that feel?
That feels good.
And after every stabilization or biomechanical correction, you want them to do their task, functional task, to see if that helped. So now what I'll do are the column 3 breakouts. The first one I'll do is the Gillette test. I'm going to palpate at the sacral base and the right PSIS. So what I'll have you do, Janice, lift your left knee up, and I'm going to palpate and find that the sacral base came into my hand, so it could be indicative of an SI instability. So what I want to check now is if I'll palpate on the left side and palpate the sacral base PSIs on that side. Now what I want you to do is bring your right leg up, and I felt the same thing. So this could be indicative of SI instability versus fixed SI. Mm-hmm. What I'll do now are some muscle palpations to check for hypertonicity leading to the SI instability. First one I can check is the paraspinals, which on the contralateral side, if they're hypertonic, can lead to the instability. Next, I can check for the ipsilateral ischiocostas, which is right here. Could feel some hypertonicity. Next, I could palpate. Next, I'm going to palpate for the piriformis muscle. So I'm going to go back to the sacral base and the PSIS right here. I want you to internally rotate your left leg and feel for the sacral base coming back into my thumb right there. That could be instability. Now what I want you to do is, I'm gonna palpate for the psoas muscle instability. So can you take a step forward with your right leg? And I felt the sacral base come back into that thumb, so I know that there's instability there. So now what I'm going to be testing for is SI A to P accessory testing. What I'll do is checking for any hypermobile segments in this. I'm just going to have my hand under her sacral base, right here. Now what I'm going to do is keep this leg extended, this leg bent. So I'm just going to bring my hand right here. So when I press into my hypothenar eminence, I'm feeling for S1, and when I'm feeling in the middle of the palm, S2, and then towards the thumb, I'm feeling for S3, and just feeling for any hypertonicity there. All right. So what I found is, through the muscle length tests, I found hypertonic ipsilateral ischiocostogeus. I found hypertonic contralateral piriformis, paraspinals, and psoas muscles. And during the deep muscle assessment, I assessed that there was weak multifidi and TA muscles. So what I found is hypertonicity of the erector spinae, and there was co-contraction present with the multifidus and erector spinae. What I'm going to be doing for an intervention is I'm going to be trying a positional release to relax that muscle. So I'm going to have you roll towards me and just come a little closer to me. Do you mind if I lift your shirt? All right. So I'm going to palpate around the erector spinae area. Can I have you bend forward your top leg a little more and then straighten out your bottom leg? All right. So I already feel the erector spinae tense up right there. What I'm gonna do is kind of have you log roll a little bit so I can bring that into an optimal position. I'm gonna be bunching up the erector spinae like this. I'm also gonna palpate to its most relaxed position. And I'm just gonna hold it there until I feel the muscle relax for about 30 to 90 seconds. All right, and once that's over, I'm gonna do a little stretch to reassess. So I'll just have you straighten your top leg, bend your bottom leg. All right. And just feel a little stretch like that. And how does that feel?
Good.
Okay. Reassess. Come back into supine.